So I'm Antonio Gonzalez. I'm an anesthesiologist here at Yale University. I did an obstetric anesthesia fellowship, so I do quite a bit of lumbar epidurals here at Yale. We have some challenges when we have patients with morbid obesity, patients with history of scoliosis, and that is corrected or uncorrected scoliosis. And it's a training facility, so trying to make sure that the residents get their best training. The Accuro, for example, it's extremely helpful to provide us as physicians with a good idea of what the depth is going to be, so that we're not really guessing. We actually have a pretty accurate idea of where the epidural space is going to be at. One of the major problems that we see with the ultrasound is that it's hard to translate that 2D image into a 3D representation in the mind of the person that's doing the scanning. So the Accuro has made that part really easy, and you have a superimposed 3D image over the 2D image. There is no more guessing. We really know where the patient's midline is. We know if there is any rotation, as it happens in the patients with the scoliosis, and we get a fair estimate of the depth to the epidural space, which is extremely important for patients that are either very slim and then morbidly obese, because those have a very wide range depth into the epidural space. It's a handheld device. It weighs nothing compared to what the traditional ultrasound weighs. Having to bring a cumbersome traditional ultrasound, it can be a problem in certain locations. So that's another problem that the Accuro can solve for your team. There's no other way than guessing. Best case scenario, you had some imaging from the patient, and you kind of, from imaging, knew if the patient had rotation to the right or to the left. And even then, sometimes the images were very old, so their rotation may not necessarily be at the same degree when the image was first taken. It went from guessing to actually knowing. If anything, you're cheating the patient if you don't use it, because a procedure that we know that at times can take 2 or 3 punctures for a patient that it may be challenging, you can reduce that. And we have evidence that for the challenging patient, the use of ultrasound actually helps reduce the amount of punctures to the patient. Nothing changes when you're performing an ultrasound, whether it is the Accuro or is the traditional ultrasound. The technique is there. You still need to have a sound technique to get into the epidural space, but knowing the estimated depth, the rotation, if there is any, it's a game changer.